Aastha Sukhija.
Hello everyone, I am Arshita Barva.
I am Chitra Garg.
Hello everyone, I am Aseem Talwar of class 10th and we are from St. Mark's Senior Secondary Public School, Meera Bagh, New Delhi, India. The year 2020 would always be remembered, not because it introduced a highly contagious and threatening virus, but also because many livelihoods got ruined due to same. COVID-19 virus has not only shown an enormous impact on the healthcare sector, but has also hindered the economy of all the nations due to downfall in GDP as there was a closure on economic activities. People tried many attempts to cope up from the economic crisis, but the things were all changed. Although work from home was introduced as a preventive measure, but through that people became prone to many other problems, like less sales in businesses, reduced salaries, etc. COVID-19 has also had a mass effect on the mindsets of the people, as they have got less spending power due to less income, and therefore both the businessmen and employees are vulnerable to a great loss. The savings of the people are now diminished as the money earned and saved was spent on the treatment of infected people.
To study the topic, we conducted surveys. Let us brief you about our research methodology. We studied the responses by the community to the set of questions put up on the online survey forms. We asked the people about the impact of COVID-19 on their economic conditions. The people also shared their thoughts on the government's plan of action and their recommendations on the better management of the economic crisis. We also managed to get some offline interviews while taking all the necessary precautions. The interviews helped us to know a lot about the ongoing situation and people's view on the same.
We covered several sections in the interviews we conducted. First, the unprivileged section. Second, the middle class. Third, the healthcare workers. And fourth, the business class.
We have to live with our spending and we cannot spend on leisure or luxury.
कि अब जो होगा हम सब के साथ होगा क्योंकि हम काम धाम तो है नहीं, इसकी वजह से अब ज़्यादा परेशान हैं.
Some bit of expenditure because when you're working from an office, the AC cost, the cost from operating from home is very different. But I think in the past 1.5 years it is pretty much stable. We are now living with the fact that this is going to continue for the next couple of years. So the cost is pretty much stable now.
So before this all pandemic situation happened, I got placed luckily, and in another 1 month or so after getting enrolled in my job, the pandemic hit and everything was shut down. Though being in a pharmaceutical company, we were the backbone of the industry as our company was somewhere related to it.
That I've been following, they are, after the first admission itself, even though government has given a capping on the hospital bills, but still, because of their prolonged hospital stay and prior decrease in their income because of the prolonged lockdowns, these patients are really suffering and they are having a financial crunch. They find very difficult to pay the hospital bills, and once they are discharged, they are again coming back even after 10 days or 15 days with some other complication.
Through the surveys and the interviews, we observed the following.
A research was conducted by our team through Google Forms and several interviews. We observed that people had been severely affected by COVID-19. Small-scale businessmen and young employees witnessed substantial losses. The per capita income projected to decline as unemployment and shutting down of businesses were common those days. Furthermore, the economic crisis affected the underprivileged section of our society to a great extent as well, as their incomes, which were originally very less, witnessed even more downfall. The people witnessed an immense loss in businesses. The big businessmen were affected due to fall in stock markets, The middle class businessmen were affected as their sales diminished due to lockdown that resulted in withdrawal of money which was invested in the business. The small scale businessmen were affected as the sales were extremely low, which eventually resulted in closure of the businesses and unemployment.
We did a survey to find out if people had been affected by the pandemic economically. 76.1% of the people agreed that they were affected, while 23.9% people disagreed. Asked the people how had the pandemic affected their expenditure. 33% of the people said medical expenses was the cause, while 67% of the people said that inflation was the reason. We also asked the people if they were satisfied with the government's plan of action. Some people agreed while some were neutral about it. Majority of the people disagreed.
Atmanirbhar Bharat is a Hindi phrase promoted by our Honorable Prime Minister Shri Narendra Modi in reference to the economic development in the country during the COVID-19 pandemic. Atmanirbhar Bharat emphasizes on India being independent in every way. People obtained major support to start small businesses and other things under this program in the COVID period. The phrase was originally introduced in 2014 in context to the national security, poverty, and the rise of digital India, but the first popular mention was made on 12th May 2020. Here is the conclusion to our research. People face financial problems. They try to cut down their expenditure to save money. They also prepared themselves mentally and financially for any uncertainness happening. People started making easy handmade products which provided them with employment. This was mostly practiced by the labor class who could not find work. The government also tried to provide people of economically lower sections with daily rations and cereals. When asked about the quality of the goods, people were not very satisfied and complained about various things. But still, it proved to be helpful. Many people of the labor class migrated back to their hometowns. Most of them decided to cultivate on their lands and be with their families.